Good morning, everyone. Thank you so much, President Daniels, for that warm welcome. As stated, my name is Dr. Letitia Dzirasa, and I am the Deputy Mayor of Equity, Health, and Human Services here in Baltimore City. It is truly a pleasure to bring greetings and a warm welcome on behalf of Mayor Brandon Scott. I'd like to start by also thanking Bloomberg Philanthropies and the Bloomberg American Health Initiative for inviting me to be a part of their summit. I want to acknowledge all of the amazing Bloomberg Fellows in the room that are serving throughout Maryland and across our country. I am particularly honored to give a special recognition to the Bloomberg Fellows who are working throughout Baltimore and city agencies, including the Baltimore City Police Department and my former home, the Baltimore City Health Department, as well as those who are serving in community-based organizations and social service organizations like House of Ruth Maryland. As I reflected on this year's theme of connection, I was encouraged by just how apt and timely this topic is. And what I hope is a paradigm shift. We are seeing the country at large, and Baltimore more specifically, break down traditional organizational silos. I believe this intentional shift will better allow us to collectively and collaboratively create innovative solutions that address the social determinants of health. Challenges like the upsurge of violence among youth have been felt throughout our country, and the Scott administration has doubled down on a multidisciplinary approach. Instead of leading with punitive measures, the Scott administration has chosen to address violence using both a public health and equity lens. Through that lens, we are co-creating a progressive and multifaceted plan to reduce violence amongst youth. In my former position as the Baltimore City Health Department, I was tasked with leading the creation of the mayor's comprehensive violence prevention plan in September 2020. Now, in my current role as deputy mayor, I have been entrusted with bringing that same public health perspective as I lead the development of the Youth Violence Reduction Framework. This framework, by design, is very intentionally centered around youth voice. Baltimore City's youth inform the topics and the themes which all of the recommendations are based. The guidance they provide will ultimately be integrated into Baltimore's existing comprehensive intervention ecosystem, a system that already engages more than 13 community and hospital-based partners across the city. It is my hope that Baltimore will continue to be a leader on the national stage as we demonstrate the importance of interconnectedness when addressing a wide range of social issues. Thanks again to the work that you all as fellows are doing here in Maryland and across the country. I know that we will continue to see public health advance as an integral part of creating safer, more equitable, and thriving communities throughout our nation. Your various fields of work, whether in education, social justice, community development, or healthcare, are so critical to bringing fresh and unique perspectives as we take on some of the nation's toughest public health challenges. Thank you again for inviting me here today to kick off what I know is going to be an amazing summit. Now please join me in welcoming Josh and Michelle back to the stage.